Good morning students, we will continue metabolism of carbohydrate, competency number 3.8, and today's topic is gestational diabetes. Gestational diabetes or gestational diabetes mellitus is a term used when the carbohydrate intolerance is noticed for the first time in a pregnant woman during her pregnancy. A non-diabetic patient who become pregnant is not included in this category. That means if we notice high blood glucose level for the first time during pregnancy, then that patient is termed as patient of gestational diabetes mellitus. In general, all antenatal women is given a glucose challenge test. This is a screening test, and this test is done between 22 to 24 weeks of pregnancy, where 50 gram of glucose is given to a patient orally as glucose load, and after 2 hours blood sample is collected from that patient, and if the blood sample shows 140 milligram per deciliter of sugar or more than that, then you can say that this test is positive. If this glucose challenge test is positive, you have to go for another test called as oral glucose tolerance test, because glucose challenge test is a screening test. For confirmation, we have to go for oral glucose tolerance test, where 75 gram of glucose should be given to confirm or to exclude the gestational diabetes mellitus. So procedure of oral glucose tolerance test and its interpretation is given in the last lecture, so refer that lecture for details of this oral glucose tolerance test. Now coming to the gestational diabetes mellitus, women with gestational diabetes mellitus are at increased risk of subsequent development of frank diabetes. Means it is an indicator for the woman that she may develop diabetes mellitus in the future. In case of gestational diabetes mellitus, the person have high blood glucose level, or mother will have high blood glucose level. This maternal hyperglycemia, this high blood glucose level enter into the fetal circulation, and it stimulates the pancreas of fetus to synthesize more and more insulin. So fetal pancreas will synthesize more insulin, and all of us know that insulin is a anabolic hormone. Therefore the weight of the baby increases. So such gestational diabetes mellitus persons should be reassessed after childbirth. Gestational diabetes mellitus may causes, as we have studied, big babies because of anabolic nature of insulin hormone. They also increases the chances of abortion. They will give rise to premature birth, or sometimes it may causes death of fetus. So this is the gestational diabetes and its consequences. Thank you very much.